Hi, I'm Jennifer Simpson. I am a nurse practitioner at Arizona Arthritis and Rheumatology Associates. I have been working at Arizona Arthritis since 2016. I go to the Phoenix office, the Glendale office, and Sun City. So gout is a type of arthritis. It is a systemic disease that can affect your joints and cause arthritis, but it can also be present in multiple different body systems, including the heart or the kidneys. It's even been found in some weird places like breast tissue or the eyes. But what happens is gout comes from uric acid crystals, and uric acid crystals can form into these chunks that we call tophi, and then these tophi can deposit themselves along the joints or along the skin tissues. Most common places that we see gout is in the feet, and specifically the great toe. So how gout looks to a person, it may feel like a lump or bump under the skin, and that's kind of if it's deposited in the skin tissues. If it's in a joint and you're having an acute episode, it can be very painful, it can be red looking, it can be hot to touch, it can be swollen, but sometimes you also can't see gout really happening because it can be in present areas that you can't see either. But it is important to know that the uric acid crystals are still present when you're not having an acute episode of pain. Uric acid crystals that are present in the joints can cause damage to the cartilage, which can lead to dysfunction, disability, difficulty using your joint, as well as the acute episodes with the pain, swelling, inflammation. But also these uric acid crystals can be present in other areas like the kidneys and the heart, which if the uric acid crystals are causing damage to the kidney, then that can lead to chronic kidney disease, or if they're present in the arteries of the heart, that can lead to coronary artery disease and lead to heart attacks. We can see quite a few different comorbidities with gout. The most common ones are, of course, how the kidney or the heart can be involved, and that's chronic kidney disease or cardiovascular disease. We also can see some association to metabolic disorders like diabetes. There's also correlation to sleep apnea and depression as well. The comorbidity is another condition that can affect a patient that can either be a cause from the one disease they have or another complication that can make their disease harder to treat. Gout, if left untreated, can lead to irreversible joint damage, which can cause dysfunction of the joints, disability, and chronic pain. It can also lead to damage to the kidneys or the heart, which can lead to comorbidities like cardiovascular disease and chronic kidney disease. Gout is not just an episodic issue, it is a systemic chronic disease that requires regular maintenance and monitoring, even when symptoms are not active.